So I'll just start over. My name is Erica Shepard. I'm the Vice President of Patient Success at MyEyes, and we rent and sell the Home2 Tonometer, which at this point is the only tonometer available in the United States for home use and for use by yourself, so without somebody else or a technician taking your pressure. And I've had glaucoma for about 12 years, and I'll tell you a little bit more about my story as we get deeper into the presentation, but I will turn it over to Hillary.
Thank you, Erica. My name's Hillary Golden. I am a glaucoma patient, and I am the founder of Glaucoma Coach, where I coach patients and work with companies to try to make the patient voice in glaucoma heard. And I'm just going to start by telling you guys a little bit about my story for those of you who don't know. But I was diagnosed with glaucoma in July of 2020. The reason I went in was for a sty. I actually had time to go in because it was during COVID. And I went in for a sty, and the doctor said, "Do you want a full eye exam?" And I said, "Okay, sure, I have time, so let's do it." We did a full eye exam, and the first thing she did was to look into my eyes and say, "I don't like the look of your nerve." And at that time, I knew very little about glaucoma. And I was like, "I don't know about this nerve, lady, but I'm just worried about my sty." And she said, "Well, I'm worried about your nerve." So we did some more tests, and she said, "I think you have glaucoma." And what I thought glaucoma was at that point was that you had to have, super high eye pressure, and you had to be, over the age of 70. And what I found out was all of that was wrong. And my pressures were really low. So my pressures were 13 and 14 at diagnosis. And I had lost almost 40% of my sight when I was diagnosed. So it was it was a lot to take in. And emotionally, it's a lot. And there's a lot to learn in order to be comfortable with kind of where your diagnosis is and just kind of accepting it. So, with my pressures being at 13 and 14, what the doctor told me was, the only modifiable risk factor that we know about in glaucoma is to lower eye pressure. And your pressure's already really low. But the normal tension glaucoma study showed that if you reduced pressure by at least 30% or more, then it showed that it was neuroprotective and that you potentially would not progress. So, with that said, my pressures needed to be at like 9 and 10 to be 30% reduced from my baseline of 13 and 14. So it was tough to process all this, and it was a lot to learn and figure out. And what I realized was that every time I would go to the doctor, we would take my eye pressure, obviously. And I was so nervous about what my eye pressure was going to be that it would, potentially raise my eye pressure for one, but just cause so much anxiety every time I would go. And it really started to just wear on me because I would go get my eye pressure and I thought, well, what if my eye pressure is higher today than it was the last time? Then what's going to happen? What do we do? What are my options? And it was, you start thinking of these scenarios in your head, and it causes a lot of anxiety. And I went to get a second opinion from a different glaucoma specialist. And when I was there, they gave me the home tonometer. It was the first version, so it was a little different in how you set it up, but they said to use it for 2 weeks and then return it when I came back, and they were going to, look at my pressures and what they were over the 2-week time period. This to me was, I didn't realize there was home tonometers. And so this just blew me away. And I said, "Wait, you mean I'm going to be able to take my pressure? We're going to know what it is at different points in the day?" And they said, "Yes." And this kind of shifted the paradigm for me because all of a sudden I felt more in control of my disease. Before, I felt like here I am, and whatever my pressure is going to be when I go into the doctor, it's going to be, and I don't have any control over that. And I don't know what it's going to be. And it caused a lot of fear and anxiety. So having the tonometer was really gave me ownership and power over disease that we don't really have much control over. So I returned the tonometer 2 weeks later. And after that, I said, I have to get one of these. Like, I need it. I don't care if I have to take out a loan, whatever I need to do, I'm going to buy one of these. A few months later, the Home 2 was coming out. So I waited until the Home 2 came out in order to purchase the tonometer. And when I did, it gave me peace of mind. And, there's still a lot that we deal with as glaucoma patients, with our pressures, with progression, with our visual fields. But having the tonometer has given me that peace of mind. And now that I've taken it at different times of the day, on different days, I know what my diurnal curve is, and I know what my pressures are usually at certain different points of the day. So I know if it's, in the morning, my pressure is going to be higher. So if I'm 3 points higher than normal, then I'm more worried, or I might use an extra drop that day, or I might take Diamox or something else that I have that I can do. At the end of the day, my pressure is usually really low. So if my pressure is higher than normal, then I might say, well, am I extra stressed about something? Have I just been working out? Did I just take a walk? Something else might have happened that gives me the clue as to why my pressure is higher. And what this has helped me do is to be able to lower my pressure. So not just through like Diamox or another drop, but also through, breathing exercises, through meditation, and and those are ways that you can lower your pressure as well as using drops and pharmaceutical methods. So it has really helped me. And then as I've learned more about glaucoma and the treatments and how to measure pressure, it has given me a lot more, like I said, not just peace of mind, but I feel more like I'm more in control of my disease. And it's really helped me move forward and not be stuck in the place that I was in, which was a very, scared and anxious place. And from that first day of the doctor looking in my eyes, telling me she didn't like the look of my nerve, to now, I've come a long, long way. And the tonometer is one of the things that's has really helped me to come that way, to come that far. And so we're sharing with you guys today more about the home tonometers, and we're going to answer some questions and go over the basics of it. And hopefully it'll be really informative for you guys. So thanks so much for joining us.
Thank you, Hillary. And that it just, some of the things you were saying really resonated with me, and I'm sure everybody on the call, right? We've all sat in the chair and waited for the blue light and just kind of held our breath. But you don't want to hold your breath. If anybody knows taking eye pressure, don't hold your breath. But it's very anxiety provoking, and it's a very scary thing. And I'll tell you more about my story in a little bit, but so tonight we're going to talk about the Icare Home2 Tonometer. Again, it's the only home tonometer available in the United States. We're going to talk about, why should I invest in a home tonometer? Is it for me? Is it not for me? And if I do decide to do that, which option is right? Should I rent it? Should I purchase it? The burning question is insurance reimbursement. And we get tons of questions about that all the time. So I will tell you ahead of time, there's no yes or no answer with that one, but I'll talk to you a little bit more about that and the advances that are being made in that right now, which is great. We'll talk about contraindications, people who probably shouldn't use the home tonometer, how you get it with your doctor, and what you can talk to with your doctor about it. We're going to hear a testimonial from one of our MyEyes patients, and then we're going to do some Q&A. And I would ask that if you have a question, and we've taken all of your questions when you registered, you wrote questions, which they were great. A lot of them were alike and some were different. And so we're going to answer those. We've kind of peppered them into the whole presentation. So if you have one that we don't answer, please put it in the chat and we will address that at the end. And then for those of you who stick it out and stay with us through the next 6 hours. No, I'm just kidding. It's not 6 hours, but through the next hour, then what we're going to do, we're going to do a giveaway, and we're going to do a free 1-week rental from MyEyes. Or if you already own a home tonometer, we'll give you 200 probes. So that'll be at the end. And you can go to the next one. So how does the Home2 work? You can see that's the device over there. I'm sure a lot of you are somewhat familiar with it. Unlike me, who when I first rented one, I had no idea there was even such a thing as a home tonometer. But the technology behind the tonometer is that it's a rebound technology. So it measures your pressure using rebound. So there's a little probe in the end of the machine. You change the probe out. They're disposable. And the little probe comes out and it touches your cornea 6 times in the matter of a half second or whatever. Like it's very quick. Yes, thank you. That's the little probe. And you can see that the legs, you adjust it to fit your face. Basically, when you get your tonometer, whether it's a rental or a purchase, we walk you through setting it up and making sure that you're going to be able to take good measurements. And the cool thing about the Home2 is that it knows where it is in time and space. So it's never going to take a measurement if it's too close, and it's not going to take a measurement if it's too far. It knows exactly which eye. It looks at the bridge of your nose. There's sensors all around the probe and the piece that sticks out. And so it knows. And a lot of people ask the question, like, is it going to hit me in the eye? Like that seems scary, right? A lot of people have some trepidation about that, but it won't. So the bottom line is it will not take a measurement if it's too close. I've been using it for close to 3 years, and I can promise you that I've never been poked in the eye. So the great thing about the Home2 is that there's no drops. So it's painless. You barely feel it. I tend to have a lot of cornea issues with my disease, and I've never had an issue with, it irritating my cornea or things like that. And I sometimes use it quite a bit. And then there's magnetic tracking. So the sensors track the probe's motion and calculate the pressure that way. Once you take your measurement, then it syncs with an app on your phone. When the FDA approved the Home2 for use in the United States, they weren't, Icare, the machine is made by Icare, they weren't allowed to put the actual reading on the device because for whatever reason, they felt that it might be anxiety provoking. So there is an app that you use on your smartphone, and the app is super quick. You just go in, you hit sync, it syncs up to your device, and then it'll show you your reading, and it comes out as a table. There's a chart, and we'll get into that. I'll show you some of those neat features. So a lot of people ask, and this was one of the biggest questions everybody had, is it accurate? Like, how accurate is it with the Goldmann? And the answer is it's a different type of tonometry. So the Home2 is rebound tonometry, and the Goldmann, and that's the big blue light, right? That you sit in the big chair. It's a big device that comes to and sits on your eye, and you have the numbing drops for that. That's applanation tonometry, which is, it's different. So the bottom line is when I've taken mine to my glaucoma specialist, I'm usually within a point or two of their machine. The Home2 patients can do it. You can do it yourself. You can have, somebody help you. We have a lot of patients who have an aide or a son or daughter or helper that help them if they're shaky or anything like that. So in the Goldmann, you have to have a trained clinician to do it. There's no anesthesia required with the Home2, and there is with the Goldmann and some of the other tonometers that you see in the office, the handheld ones. And then there's also, so some people with thicker or thinner corneas can tend to read different. I'm sure there's a bunch of you in this group that are like, yeah, I'm thin cornea. Yeah, I'm thick cornea. And you know that, and you adjust for that. And it's the same with the Home2 that it is with the Goldmann. So people, adjusting for their cornea happens with both. So portability, obviously the Home2, you can take it pretty much anywhere. I always tell people, My kids ride horses, and so I take it to horse shows. I take it to hockey rinks because my son plays hockey, and it's very durable, and it just kind of goes everywhere with me when I need it to. Um, Data recording with the Home2, obviously you've got a record, and we'll show you some of this. You've got a record of all of your pressures at different times of the day, which eye it was, were you sitting up, were you laying down? And yes, you can take it laying down as well, because that was one of the questions that came up. Hillary, you want to talk about monitoring?
Sure. So, we got a lot of questions on, how often should I measure, and should I measure in the middle of the night? And what I'll tell you is it you might want to work the times with your glaucoma specialist. So, when I first got mine as a loaner, they wanted me to measure my eyes at 7, 11, 2, 4, and before I went to bed at like 10, 9 or 10. So they gave me certain times that they wanted me to measure because they wanted to get that diurnal curve. But it's kind of up to your glaucoma specialist. But I would say, for me now, I usually take mine in the morning and at night for sure, because that's when I'm at home. The rest of the time, if I'm out during the day, and I don't bring it with me necessarily, but there's some days where I do take more measurements. And now that I know what my diurnal curve is, kind of like I talked about earlier, then I know if it's higher or lower. I have woken up in the middle of the night to take the readings. So I think it's important to take them in the middle of the night to see if you're spiking really high at night, because your doctor's not going to get that information any other way but by you waking up in the middle of the night and taking your pressure. So it can be very helpful. Yeah, I missed the other questions that were on the first page, but that diurnal curve tells the doctor a lot of information. So the position we talked about, Erica kind of touched on that, but sitting, lying down, standing, and that's the beauty of the tonometer is the first version you couldn't take it laying down. So with the Home 2 you can take it laying down, and it's super helpful. And then when you go into the diurnal curve measurements, you're just seeing what your pressure is doing throughout the day. And, that's why when you first get it, you're like, oh my gosh, my pressure's higher, my pressure's lower. And this is why it's so crazy to think that your pressure is being treated by one measurement in the office by the doctor every 3 to 4 months. How do they're missing all of this information. So this is where we're filling in a huge gap of what's happening with your eyes when you're not in the office.
So I liken it to blood pressure, right? So if you have high blood pressure, you're not going to take your blood pressure one time every 3 months and take that as law. And I'll jump into my story. So I was diagnosed with ICE syndrome. And if there's any other ICE people here, please let me know, because we're a rarity. Love to talk, love to chat. But I was diagnosed with ICE syndrome. So glaucoma is secondary. It's only in one eye. Early on, I realized we needed a shunt. So I had an OMID valve implant, and I was great for like 8 years, and started to go back into the office, my regular visits. And I had graduated. For those of I graduated to every 6 months, which was just a huge deal, right? So, but then my pressure was like in the low 20s, which for me wasn't terrible. And because of the rarity of this disease, my doctor was like, look, I'm going to send you to a bunch of different specialists, anybody I can think of, and we're going to figure out, we knew we needed a second shunt. And there just weren't a lot of studies that would point us in the right direction. So I did. And when I went to one of the specialists, they're like, you should get a home tonometer and rent one. And I'm like, I have never even heard of that. And I'd been so stable for so long, I didn't even really give it a thought. So I rented the home tonometer for MyEyes. I certainly did not work for MyEyes at the time. And we found that my pressure was spiking into the 40s. So with what we thought we had a few months to kind of figure out, my optic nerve was stable, everything was going okay. I had surgery like 2 weeks later. So this tonometer saved my vision by far. And so, just like Hillary said, when she rented hers the first time, and I'm sure a lot of you have had this experience, and I rented it for a week and I had to send it back, and it was like saying goodbye to a friend. Like, I just was like, I need one of these. And it took me some time, right? Because they are pricey. I'll get into the price, but it's probably one of the best things I've ever purchased, and it saved my vision and changed the course of my therapy on multiple occasions. I've been using it for about 3 years now. So is it safe to use? Yes, the FDA approved it, I believe in 2017. And somebody asked a question like, it's hard to have an app, and really you should show the IOP number on the device. And I 100% agree. And it's kind of frustrating, but that's just kind of what we were saddled with. So, at some point we may be able to change that. The European models, which don't work in the United States, they actually show it on the tonometer, so that the technology is there and it can happen. So, consulting your doctor, I mean, that's really what anybody needs to do. There's some doctors who still may be naysayers or may not be comfortable prescribing home tonometer, or it's in the medical world, it's a fairly newer technology. So and there's only one on the market. So that, I think, can cause some trepidation for some doctors, but other doctors, my doctor was kind of like, you can rent it. I don't know, like, it's going to be like, whatever you do, you kind of thing. Like, she's just like, it can't hurt. And she was a believer after that. She, once you see the chart and once you see the numbers, it's no pun intended, it's eye-opening. It's just amazing what you can track, and you can see what your pressure is doing anytime you want to. Do you want to take this part, Hillary?
Sure. So why should we monitor eye pressure at home? We talked a little bit about this, but it tracks how your eye pressure fluctuates throughout the day. So we all have fluctuation. Even people that don't have glaucoma have fluctuation in their eye pressure throughout the day and at night. This gives doctors the actual data of what your eye pressure is doing. And so, like Erica mentioned, they would never have known she was going into the 40s if she didn't have the tonometer. It's just something that you don't necessarily know. There's a lot of people like me who get diagnosed with normal tension glaucoma, and then they get a home tonometer and they're in like, they're having pressures above 21. So if you have pressures above 21, you're not normal tension glaucoma. So it might change the way that that you're treated. So that's why it's so important, because just that one pressure in the office doesn't give the complete picture. It gives a little part of the picture, but there's so much more to eye pressure than just that one pressure. So that's why it's really important to have the home tonometer. Also, kind of piggybacking onto what Erica said, if your doctor is skeptical and say you just want to rent it, I would rent it during a time that you're going to be going to an appointment at the doctor and at your glaucoma specialist. Bring the tonometer with you and measure it. I've brought mine with me and I measure it against the Goldman. Just like Erica said, mine is usually within 1 to 2 points, or sometimes it's exactly the same. Sometimes it's 1 off. Sometimes it's 2 off. The most it's been is 2 points different than the doctor. So that's just kind of, that gives them the information, because I was the first one of my doctor that had it. And so he wanted to know just as much as I did. And I think it's helpful to bring it in. So if you do choose to rent it just to see how it is, I would rent it when you're going to go to the doctor, so you can see what the difference is between the two, if there's any.
So thank you, Hillary. So sharing the results with your doctor when you rent or you purchase, most people that purchase a tonometer download their own information and take it to the doctor. But at MyEyes, that's something we can do for you as well. So, Hillary touched on both of these, being able to collect that data. Somebody asked the question too, and I want to address this. In the app, you can't make any notes at this point. I know it's something that Icare is working on, and Hopefully you'll be able to make a note. Like when you take your pressure, you could say, I just took my drops like a half an hour ago, or I just did yoga, or, you know, I just went for a run, whatever it is, and just being able to make those notes. But for those of you who do own one, or if you rent one, a lot of our patients will actually just make a spreadsheet on their own and they put in the information on their own. So it's kind of a workaround right now, but they are working on that. And that is something that hopefully will be available in the future. For data sharing options for rentals, we send your results to both your doctor after you return the device. And to return the device, you literally just put it back in the box. We give you a label, send it back. For purchases, you can download it anytime you want in the clinic portal, or you can ask us to send it directly to your doctor. And this is the cool part. So this is an IOP chart example. This is the actual chart that prints out from the Icare clinic and the clinic software that goes along with the tonometer. And you can see that this sample, this patient, and this is a real patient, the highest for OD is, you probably know this, but OD is right eye, OS is left eye. So you can see the difference not only in the IOPs with the two eyes, but you can see that the right eye, the highest measurement over that time frame, and that's for a 1 week rental. That was somebody who rented, you can see from like December 23rd to about the 31st. So their highest was 40 and their lowest was 24. And their mean, their average IOP was 31.1. And the left eye, a little bit lower, 34 and 20, and the mean was 25.9. So you can see right away, like the information that you get from this, and you can see this person in particular. The thing that struck me about this person is their fluctuation. So, you know, if you read the studies, it's not just the peaks. It's not just that your pressure hit 40 or it hit 30. If your pressure's going from 15 to 30 or, you know, 20 to 40, or, you know, you have a really big fluctuation, they're finding that that can cause damage as well. So it's just really important to be able to see that. And interestingly, we can look at the next page in a second, but on the bottom, you see, we didn't print out the chart, but it comes out as a chart. So where you can see there on the bottom, the date, the time, the device name, and then that's the IOP reading for the left eye. And you get a whole chart. Like you can print out, I had one the other day that was like 81 pages long. We did not print it, but I did send it. So, so yeah, you can take as many measurements as you want. I mean, generally when you rent, and it's completely up to you and your doctor, and every doctor does it a little bit differently. Some will recommend a 1 week rental. Some will recommend a 2 or 3 week rental. And again, it's really up to you and your doctor. Generally, we say that you probably test about 6 times a day. And as Hillary mentioned, making sure you're getting that early morning and that late at night. And if you happen to get up in the middle of the night, go ahead and take it then too. And, you know, but for me, the way I use it now is I was in my glaucoma specialist the other day, and my pressure since my second shunt has been like under 10. And I happened to be 21 in the office the other day. I didn't have my home tonometer with me either, but I got home and it was like 20. So it was in the same category. So what I was able to do, I don't test every day now, but what I was able to do is I started testing, you know, 6 times a day for the next week to see if I really was spiking or if that was just kind of a one-off. Luckily it was a one-off. So, but that's the empowerment. You know, Hillary mentioned being a patient voice, and that's really what home tonometry is all about, is being able to empower yourselves to see what's really happening in your eye every day on a daily basis. So you can go to the next one. So when we send information to the doctor, or if you own a machine or if you rent a machine, you can print these reports yourself. This is a diurnal curve example for the left eye. So it gives you the times across the bottom, and this was over that entire week period. So this is the average that the IOP was during those times. And you can see, overnight 0 to 259 in the morning, it's a lot higher. And then it's, goes down in the morning. Probably somebody put their drops in, who knows? And then it goes back up in the afternoon and in the evening. And the other thing that really it really tells a story, because when you look at that, you can say, okay, maybe I need to do drops at a different time during the day. Talk to my doctor about that. Maybe I really do need some intervention. It tells a story, and it gives the doctor so much more information than just one measurement every 3 months, in the office at 2:00. And you can kind of see 2:00 is not an issue for this person. And for a lot of people, the curve looks just like this.
Yep.
So you can go to the next one. That's the left eye. And then we've got the right eye there, and it's kind of the same type of picture. And again, you can see the highest is 25 and the lowest is 12. That's a big fluctuation.
The other thing I'll mention, Erica, is that you can set, if you're on the computer, you can set the timeline to be whatever you want. So if you want it between, certain dates, you can change those, which is amazing because, if you were traveling one week and you brought it with you and then it was lower and then you got home and it was higher when you went back to work, like, is work stressing you out, or you're more relaxed on vacation, like, you can kind of figure those things out when you look at it over time like that, as opposed to just one little measurement. So that's where it's super helpful, is just different weeks and picking out different timelines to measure your pressure and get your mean and get your average at that particular time.
Yeah, for sure. I see a comment I have to address, Linda, on the side, that your doctor never got a copy after their rental. Sometimes where we have it, we send it in PDF format. Some clinics will just block it and it goes into their junk. So I can look back and I will tell you exactly when we sent that, and I'll send another copy to your doctor for sure. So, because that information is really important, and we try to make sure as soon as we get that machine back, that we download that information and get it to your doctor within 24 hours. So the other thing I will mention is that if you do a rental and you're not comfortable downloading an app and reading the information and getting the IOP, some people just it gives them some anxiety and they don't want to know. You don't have to download the app. If you're renting, you can just take the measurements and send it back to MyEyes, and we'll download all the information. It keeps it in the machine, and then we bring it back and download it. So which option is right for you? Hillary, you want to talk about the post-surgery use?
Sure. So a lot of doctors want to know what the pressure is, especially, like, we're not, a lot of patients aren't just having glaucoma surgery, but they're having like a combo cataract surgery, or they might have already had combo cataract surgery and then they're going to have another surgery added on. So the doctor wants to know, like, what you are before and after, to let them know if you need to go into the office. It also helps you because if you don't need to go into the office, then you don't have to keep going to the office, because all they want to do is check your IOP. So it's super helpful to have that at home where you can track it yourself, and then the doctor knows they can keep a closer monitor on you, because they're not going to have you come in every day, but they might want you to send in your IOP every day to the clinic manager or one of the techs, which is very helpful for them. So it's also really helpful for people that get SLT, or if you have like a sustained release medication like Durista. So these procedures and these sustained release can stop working after a while, and this gives that information as to when you start trending back up, as opposed to staying lower. They want to know when that changes, because maybe you'll get another SLT, or maybe they'll decide that, no, the pressure's going up too high, we want to do a surgery or something else. So obviously, everything that we're talking about, we're always going to go back to, it's best to ask your doctor, because some doctors don't want the information. Most of them do, but we want you to ask your doctor, when do you want me to take this after surgery? How often do you want it? Do you want me to send it to you or not? Do you want me to send it to you every day? Do you want me to send it to you once a week? And then you're both on the same page, and you're following their instructions, which is always what we want to do.
So the pricing table at MyEyes, and I will say that there are currently 4 distributors in the United States for eye care that either rent or sell the home tonometer. We are the only licensed DME provider at MyEyes, and one of them can only distribute to California. So, but the prices are all similar, but they can vary a little bit. So we have a 3-tier program that pricing program that we have. So the diagnose. So if you're looking to diagnose, am I fluctuating? Am I spiking? What's going on over the course of a week or 2 weeks? That cost is $249. And it's $149 per week after that. And that's again where, the doctor's recommended it, you get it, you take your pressure, you send it back, and then you have all of the information. We also have recently added an aftercare, and this was at the request of our doctors because they have people that have different procedures. For me, I had a Bearvelt valve and a Bearvelt shunt, and you'll know that it takes a few weeks for that to kick in. And so I had a home tonometer when I went through that. So with the aftercare, it allows the doctor to take a look at your IOPs before surgery or laser or whatever procedure you're having done, during, like directly after, and then like 6 weeks later. So it's a monthly subscription, and it's a minimum of 3 months, but you keep it in your home for the whole 3 months, and you can certainly extend that if you wish as well. Anybody who rents or does the subscription will get a $125 discount off of a purchase too. So we get that question a lot. And the purchase includes probes, a case, accessories. There's warranty options available, and you have the MyEyes service. And I have to say that we are a team of glaucoma patients. So when you call into MyEyes, you're speaking to somebody who knows exactly what you're going through, and you're talking to somebody who's probably been through a lot of the similarities that you are, and same with getting into home tonometry. It's a great team. They're awesome. Okay, the burning question: does my insurance cover it? And the answer is yes and no. So when I first came on with MyEyes back in January of 2023, and it was right after I purchased, so it was kind of cool that I purchased and then got to come on and work for MyEyes. I was just from my story, I was just such a huge believer, and just happy to see how can we get one of these in the hands of every glaucoma patient. And MyEyes was founded by world-renowned glaucoma specialist Dr. Barbara Roscoe, and one of her patients. So again, we're a team of either glaucoma patients or professionals, and that was really their mission: is how do we get one of these in the hands of every glaucoma patient, because it's just so critical. So with the insurance, what we recommend is at the very outset, call your insurance company. And if you get a no, like, this is a durable medical equipment, I have a prescription for it, will it be covered? I mean, you do have to kind of know if your insurance pays for durable medical equipment to begin with. Some do, some don't. But definitely call. And we always say, like, if you get a hard no when you call the first time, call back, because it really does depend on who you talk to on the other end of the phone, and you have to be persistent. So right now, Medicare does not reimburse. Icare is in the process of trying to get what's called a HCPCS code, which is a device code. There's no device code now for a home tonometer at all. So once they have that code, it'll be more recognized as a durable medical equipment. And for right now, we encourage people to use another code that's E1399 for miscellaneous durable medical equipment. And some people have been very successful. So, I look at Tufts. We have one patient that Tufts paid the whole thing and continues to pay for probes along the way. Like I said, when I came on at the outset of 2023, it was just a hard no. Like, we just had to tell patients, like, no, the insurance doesn't pay for this. But we've had more people, thanks to our patients, it's like a grassroots effort, and they're out there digging and trying to get reimbursed. And at MyEyes, we give you everything you need to submit a claim. We cannot submit it for you, but if it's a letter, we give you a blank health insurance claim form. We give you a sample one so you can see how to fill it out. We give you a copy of your prescription. We give you everything that you're going to need to submit a claim, a detailed receipt, and we're actually making some changes with that now, so it's very, very detailed. And we've had all of these insurance companies that you see here. We've had somebody get paid, times multiple people. But again, you look at Blue Cross Blue Shield. It's just such a huge company. It just depends on your plan, and it depends on where you live, honestly. And again, the key factor you want to ask if your plan covers DME equipment. So getting reimbursed, the steps involved, and it's on our website as well. Even if you don't plan on purchasing or buying from MyEyes, renting from MyEyes, I encourage you to go onto our website and take a look. Some people are now getting prior authorizations. I don't know if you've ever had a medication. You probably all have, because you're all probably on glaucoma drops, which we know usually require some kind of prior authorization. And once you get the prescription, a lot of times the doctor will have to put in what's called a prior authorization and get authorization for you ahead of time. We've had a few people recently be successful in actually getting a prior authorization, and it takes, the help of your doctor. But usually, every doctor's office has somebody that deals with prior authorizations, and it's pretty routine for them, but you may need their help in getting that. And again, I mentioned after you purchase or rent, MyEyes provides all the required documents that you need. And I mean, again, it's a grassroots effort, so we're really there to assist you and help any patient that we possibly can get paid. And it's definitely way bigger than it used to be as far as people getting reimbursed. And again, you have to be very persistent, and you may get appealed and you go back, and it's not a quick process. Sometimes it is, but usually it's not a quick process. But in my opinion, if everybody's insurance would pay for this, that most people with glaucoma would have one. It's like having a blood pressure machine or a glucose monitor. So everybody would have one. Do you want to talk about contraindications, Hillary?
Sure. So, when should you not use the home tonometer? So number one is if you have an active eye infection, you don't want to be, spreading it to both eyes or irritating what's ever happening, eye trauma, surgery. If you're having any kind of corneal surgery, you want to talk to your doctor about that before, to make sure that they want you to continue using it after that type of surgery. If you have problems with just holding the tonometer, that doesn't mean you can't have someone else help you and hold it. But for you, if you have, any problems holding it or have limited hand dexterity, then you want to, refrain from using it and maybe have somebody else help you with it. If you have frequent eye spasms or uncontrolled eye movements, nystagmus, then it's going to be hard to take the measurement, but you already know this because this is what happens when you go to the eye doctor anyway. And then if you're outside the corneal thickness, then you can get readings that are not going to be as accurate. So for the majority of patients, the Icare is going to work for them, and then there's going to be some that we would tell you to refrain from using it in those certain cases.
So you do need a prescription because it's a durable medical device. You need a prescription from your doctor. Pretty simple. We've made it super simple for our physicians that they go onto our website. They fill out a form. That form comes to us and it serves as a prescription. However, you can upload it. You can take a picture of it if you have a prescription and send it to us. We can help you get the prescription as well. I'm a registered pharmacist, so that helps sometimes when I call an office and we need to get a prescription. But the prescription must include your name, your date of birth, your phone number, the doctor's contact info, and whether it's for a rental or a purchase. But it's pretty straightforward. I mean, somebody mentioned in the chat that, you know, there are doctors who will not write or they don't feel comfortable with it, and that's okay. You know, we've had people go to their primary care physician if they really want to do it, and they'll write a prescription for it. So it just depends on your situation, but it's pretty easy. So on the call, we should have Mary Lou. I don't know if you're with us. Mary Lou's going to tell you about her experience.
Can you hear me now?
Yeah, we sure can.
Oh, hi.
Hi.
What all would you like me to tell you?
What's your experience been, and how did you get into, I should say, into home tonometry?
Okay. I have to tell you that I've been a registered nurse for 47 years, and I'm a master's prepared nurse. I've been a diabetes educator for years. I've always worked in positions where I advocate for patients. And then I got glaucoma, and then COVID came, and we ended up without physicians who treat glaucoma here in Billings, Montana, where I live. So I was referred to Dr. McGinnis, who's in Bozeman, Montana, and he has been absolutely wonderful. He shortly after I started going to him, if my voice is raspy, I'm sorry, I had an upper respiratory infection I'm recovering from. But he came in one day and he gave me all the forms and he said, I think you should get one of these. And I said, oh, okay. And he said, well, look into it and see what you can find. And I did. And I was like, wow, yeah, why doesn't everybody have it? That's managing glaucoma without one of these is like shooting in the dark. It's like giving someone insulin without knowing what their blood sugar was. So my husband and I agreed. We just bought one. It's well worth it when you think of the cost. I mean, you can't go on a cruise for that. And, you know, if you go out to eat, that would quickly build up to that amount of money. So we just really thought it has been worth it, and it sure has. One of the things is y'all have already talked about a lot of it, but I'm on 140 miles away from Dr. McGinnis. And so I'm able to do my pressures, and then I'm not brave enough to send them in myself. So I call Doris and she sends them in for me. And I usually see him every 3 to 4 months. He's really excited to see all the readings he gets and all the analysis he gets, and is just amazed at everything that he gets from it, and that it's certainly worth it. We've found out that the blood pressure medication that I was on was contributing to an increased pressures in my eyes. So we were able to work with my primary physician to get me off the blood pressure med that was the problem and onto another one. I also have allergy issues, and I just love Zyrtec, and then I found out that, whoa, Zyrtec just bumped those pressure's right up there. So I've had to work and find an antihistamine that didn't influence my pressures as much. Recently, I have had this respiratory infection, and then Dr. McGinnis, started me on a new eye drop, and I took it for a while. And then one morning I woke up and my eyes were swollen shut and completely red and swollen. I called his office. It was in the middle of a blizzard. And so we talked through things and decided to drop that medication. And we went back to some other medications that I had had before, and found that, first of all, we dropped the medications in the evenings, and my eye pressures just skyrocketed. And then we went back to doing the ones that I do in the evening, and split them between two different medications. And now my swelling's going away. I still have a little puffy eye, but that's okay, or a little discoloration. But just by sending my pressures in, he's been able to adjust my eye drops. We've been able to work all that out. He's been able to see what my pressures have been, and has been able to monitor me and change medications 140 miles away, which is, I think, a tremendous idea. And I also think that it's where the management of disease is going, and especially in our rural areas. 140 miles, by the way, is not a lot of travel for us. That's only about 2 hours when you go 85. But it really gives us a good chance to talk to our doctors and to be able to give them information back. I just am so impressed with this tonometer, and my granddaughters have always bought into this too. And now we had spent Easter with them, and they were on me all the time to check my pressures and do this and do that and give my eye drops. And it's been a way to involve them into what's going on with me too. But I have to say thank you to all of you folks out there. You have been more than helpful, very, very supportive from the very, very beginning. I have not felt like I was in this alone. I felt like I had people on my side, and have worked through the process. And I can't imagine not doing my own pressures anymore. I usually do in the morning before I take my pressures. I do at noon before I do my noon drops. I do in the evening before I do my evening drops. And then anytime in between, if I get curious or when I was not doing really well, I'd check them just to see how they work.